It is pertinent to note that the environment in the IVF laboratory should be as ideal as possible, so that the culture media, temperature, pH, etc. have a positive influence on the quality and grading of embryos. Now here are the various stages of embryo development. Here is how a 2-celled embryo looks like. Subsequently 3, 4, 5, 6 cells, 7 cells, 8 and 9 cells. These are how cleavage stage embryos look like, and these are all good quality embryos. Now what else do we look at? Without getting into too many technicalities, each blastomere should have a single nucleus. Multiple nucleation has been associated with genetic disorders of the embryo and also with an increased risk of miscarriage. What are the characteristics of a grade A embryo is that the blastomere should be of equal size, there should be little or no fragmentation, the zona pellucida should not be extremely thick or dark in appearance. A grade B embryo, again the blastomere should be of equal size. Minor cytoplasmic fragmentation covering less than 10% of the embryo surface. Like this embryo here has no fragmentation, whereas here these tiny dots that you see, those are signs of fragmentation. A grade C embryo, again the blastomeres of distinctly unequal size and moderate to significant cytoplasmic fragmentation covering more than 10% of the embryo surface. So here again the fragmentation is between 30 to 50%, and here more than half of the embryo is fragmented. Cytoplasmic homogeneity is a sign of normal cleavage stage embryo. The presence of multiple vacuoles is a sign of a poor quality embryo. Compaction. After the embryo reaches 8-cell stage, the blastomeres begin to show an increased cell-to-cell affinity, and this is known as compaction. And the process continues until all the boundaries of the blastomeres pretty much merge with each other. If some of the blastomeres stay away from the compaction process, the embryo may have a reduced potential for becoming a normal blastocyst. As you can see in this image here, the cells are coming together. This is a sign of compaction, and it is a good sign. It means that the embryo has the potential to go to a blastocyst and hatch and ultimately implant. Day 5 or day 6 embryos are called as blastocyst. It is a stage which the embryo must compulsorily reach before it can hatch and implant. It consists of a blastocele, a trophoectoderm and an inner cell mass. The trophoectoderm usually develops into the placenta. The inner cell mass, this develops and becomes the fetus. The blastocyst is usually graded with 3 main components of the blastocyst embryo. Based on the expansion grade, it is an early blastocyst, a full blastocyst, a hatching blastocyst, and a fully hatched blastocyst. As you can see in the images here, the early blastocyst, the blastocele fills up more than half of the volume of the embryo, but no expansion in overall size compared to the earlier stages. A full blastocyst, the blastocele filling up more than 50% of the embryo volume and overall size fully enlarged with a very thin zona. A hatching blastocyst, the trophoectoderm has started to herniate through the zona, and a fully hatched blastocyst where the blastocyst is fully removed from the zona. We'll see in the later images of a hatched blastocyst. As you can see here, this is a hatching blastocyst. The inner cell mass should be tightly packed with compacted cells. This is a sign of a grade A blastocyst. A grade B blastocyst, the inner cell mass, the cells are loosely packed together. In the grade C blastocyst, the inner cell mass is not distinguished at all. Whereas a grade D blastocyst, cells of the inner cell mass appear degenerative. Similarly, the trophoectoderm grade is A, B, C, D according to these parameters. If the cells are healthy and form a cohesive epithelium, then it is grade A. Grade B, the healthy cells are there but are fewer in number. The grade C are the unevenly and poorly distributed cells, and grade D is cells of the trophoectoderm appear degenerative. Embryo freezing. These are the steps in embryo freezing. The first step is obviously the consent, because this is of utmost importance before you can freeze the embryos for your patients. Screening of all the partners involved, the male partner, the female partner, the egg donor or the sperm donor should be tested for the infectious diseases. The unused embryos can either be frozen with the standard freezing method or the slow freezing method or the fast freezing method, which is known as vitrification. Nowadays a lot of inclination is there to move away from the slow or the standard freezing and move to vitrification, because with vitrification the chances of survival are more. How long the embryos can be stored? Well, essentially they can be stored for a very, very long time, 10 years, 15 years maybe. It is expanded depending on the medical circumstances or the requirements of the commissioning parents. Now another thing I have been asked to speak about is embryo shipping. Now a lot of you present here would have embryos stored or frozen. Not just in Australia, we get a lot of patients from different countries who have their embryos frozen. Earlier there was no standard process, but now the Indian Council of Medical Research has stepped in, and if you have to ship embryos to a clinic in India, then you have to apply for a no objection certificate from the ICMR. So these are the formats for the certificates to be obtained. One is your clinic in Australia or whichever country your embryos are frozen in will have to provide a written declaration in this format, and then the receiving clinic in India will also sign a declaration in this format, and this is the declaration which the infertile couple will sign. And once these things are in place, then the receiving clinic will submit these documentation along with the other documentation that is required for obtaining a no objection certificate from the ICMR, and only once this no objection certificate is received, only then can the embryos be shipped. Thank you everybody for your patience and listening. I hope this has been informative, and once again I miss not being in Australia at this moment, but I wish you all very well and good luck. Thank you.